So our guest speaker today is Dr. Asasla Ignatius. Asasla Ignatius, medical and surgery from Makerere University, immediate past president of Makerere University College of Health Sciences, Students Association and Vice President, Federation of Uganda Medical Students Association, currently working with Ministry of Health, Department of Public Health Emergencies. With wide interest and passion in global health, is an upcoming youth research and special interest in international policy. A proud Catholic, a Rotaractor from Rotaract Club of Mulago and member of Uganda Medical Association.
Thank you very much, and I hope I'm audible. Could the host kindly allow me to do screen sharing because I need to project the PowerPoint? Otherwise, as the host is giving me the sharing, right? So good evening, ladies and gentlemen. And I hope those who are outside Uganda, across the seas, whether it's morning, whether it's in the afternoon, bonjour. Yes, so like I've been introduced already, I'm Ignatius Asasira, and I am excited and humbled at the same time to be invited to share this discussion. So the reason why I chose this particular type of discussion is because of what is currently happening in our country, in Uganda. We are currently in the middle of an epidemic, or initially it was an outbreak, but we are almost really calling it an epidemic, which is Ebola, and it has affected us from most of the corners of Uganda.
Okay, we are basically educational missions. We try to support people with as much free education as possible. If you look at our website, which at the end of this meeting, Conrad will go over it, you'll see where we have Khan Academy on there, which takes us all the way from kindergarten through college courses. We'll have lots of additional training courses there. And we use as a foundation a book that we call Think to Prosper. And Think to Prosper is really about taking time with ourselves, stopping, thinking about what it is that we want to accomplish, and beginning to develop a working plan for doing that. We feel like a lot of people can achieve a lot more than they're possibly presently achieving if they will follow a simple system. Let me just give you that system real quick while you're on the line. We use a mnemonic device. A mnemonic device is a tool that triggers your brain and helps you to remember things. And so our goal is to help you to remember a simple system of accomplishing things. So we use this, which is called a logic die. You know, normally you think of die or dice as just a toy or something to gamble with. This is not a gamble. This is you're making a conscious decision on doing something. And each side teaches you a lesson, and that's why we use it. 6 just teaches to do our best. It's the highest number on the die, and it teaches to do our best. But how do we do our best? By focusing on one thing at a time. Every time that we've ever done our best in our whole life is because we've been focused. Any one thing that we focus on, we know we just need to break it down into 2 sides. We need to ask questions. You know, Benjamin Franklin used to take a sheet of paper and he would divide it in half. He'd look at the pros on one side, the cons on the other side. Okay. When we're trying to accomplish something, we need to say, yes, I'm going to do this, or no, I'm not. You know, we can't have a closed mind. We need to have an open mind. So any one thing that we want to do our best on, we literally want to begin to break it down and ask ourselves questions in 3. We're right here in the middle. You want to talk to this person, get some outside advice, and that person's gone. You want to talk to an expert over here on this side, get their advice, and then that person's gone. But now you know what that person knew, and you knew what that person knew about that one thing that you wanted to do our best on. So in life, it requires us, if we really want to do our best, in life, it requires us, let me stop that, okay? It requires us to focus with a commitment to do our best. And the power becomes when we take a sheet of paper and a pencil, okay, or a pen, and we begin to write down our thoughts. Because out of our imagination, we can, all things are created. And we begin to know and to understand the things that we need to accomplish through that. So our goal is a free book we call Think to Prosper, and we have a number of books that are online for you for sale, or actually for free. We also have a new book that has just been recently put up there for you, and let me get it for you. It's called The Richest Man in Babylon. Okay, The Richest Man in Babylon. This book was written over 50 years ago, but the principles are so solid. So we provided them for you, and it talks about how to become wealthy. And really becoming wealthy is about managing your income and taking a certain amount of money that comes in. So when you have money that comes in, you want to set a portion of that, 10% or so, put aside for yourself, okay, that you're going to take and manage, and you're going to begin to grow. So there's a number of free books on there. There's a lot of instructions. I just encourage people to go on to educationalmissions.com or .org, and Conrad will tell you a little bit more about it in a few minutes after we're completing here. Just get on, register. There's no charge. Even when you pull up Khan Academy, which is going to have a full schooling on there, it will say, you know, give a donation. Educational Mission already takes care of that donation for you, so you'll pass right by that. You won't be providing them a donation, because we provide that donation to bring that resource to you. The other thing that we do is we have a couple of folks that are available. Conrad's available to you, where if you have something specific that you want to get an education in, that you want to grow in, we will try to take and to find some educational resources that will be free to you, so that you can take and apply those in your own life and change your own life to the things that you do. So that's where we're at. You ready, Mr.? We ready there, Conrad?
Yes, Stanley, thank you. And maybe what you did talk about is we have hard copy books of Think to Prosper. And this book was written by Stanley. It is a guide to the logic die that Stanley was talking about. So the same logic die that you see here, it has a book, which is the Think to Prosper book. We have hard copies and soft copies of the book. So in case you need a copy, we are located in Tintale, HW Mall. Those who have been to Tintale, there is a new building called HW Mall. So in case you create time, you can just pass by. You can get a copy of a book. And then in case you don't have time to travel, you can still download the book from our website. And I think at the end of this meeting, I'll show you how you can get a soft copy of the book. I'm sure it is going to be interesting. Then the other book that Stanley showed you, The Richest Man in Babylon, we have that book on Amazon. It is being sold, but we have a free copy for all Ugandans. So you can get a free copy from our website as well. I'll show you how you can also download a free copy from our website. Without wasting time, allow me once again, welcome Dr. Asasla Ignatius.
Thank you very much, Conrad. I hope you found the PowerPoint, but as you do the screen sharing, I think we can start the discussion. So I hope we all have asked that the country is currently being faced with a challenge of Ebola virus disease, EBV. And this is not the first time Uganda is being hit by this virus. This is actually the fifth outbreak, with the latest, which happened about 10, 15 years ago. As we talk right now, we initially had the epicenters, epidemiological centers of this virus, mainly within 5 districts of Kasanda, Chegera, Mubende, and 2 others which were initially in Western Uganda. The virus has actually spread to very many other districts, including Uganda, rather Kampala. And our duty today is how can we discuss our role as young people in this response, and having volunteered and worked with the Ministry of Health in the Ebola Rapid Response Team on the case of surveillance pillar, I wish to share my experiences as well. Currently, like I already said, we have Mubende, Kasanda, Cherera, Unyangabo, and Kagadi being the main epicenters. But in Kampala at the moment, we are having up to 14 cases, and every other day we are getting new confirmed cases. We have a cumulative recovery of 25 cases as per yesterday, but these statistics are not of today, so there may be a few alterations. By then, the cumulative confirmed were 61. So this is the summary of the districts I talked about earlier, with 3 confirmed cases as per 2 days ago, and about 25 recoveries. And with a total of 64 cases, confirmed cases, and only 25 recoveries, with 25 confirmed deaths, it means we are at a case fatality rate of about 60%. But this case fatality rate from the previous outbreaks can go as low as 40 and as high as 90. And that's why we all need to take caution in this response and see how best can we join our hands together, especially as young people, and see how can we contribute to this response. If you go on the next slide, this slide talks about the distribution of confirmed cases by status. And I don't want to go into the deep demographic features of the graphs, but it simply shows that around mid-September and at the start of October, the cases went on increasing compared at the start, where we had an index case on the 8th of September. And on the next slide, I don't know if we have some health workers in the house. It shows the age distribution of these infections that are amongst the health workers. And 90% of all the infected health workers are actually males, and only 10% being females. And this really prompts us to question why should we say the females are more at practicing the infection prevention measures than the males? Should we say the males are more aggressive and they go to attend to patients without, wearing gloves, without wearing the personal protective equipment? And even out of the 4, by then, by the time I compiled the statistics, the 4 health workers who had passed on, over 90% of them were actually males. So on the next slide, it shows a district distribution of the active contacts by district. But I wish to inform you that by now it's actually even much bigger than this, because at that time we had only 53 active cases in Kampala, but now we have over 100 active contacts. Not cases, but contacts. A contact is, as the name says, someone who has been either in direct contact with the confirmed case, or like we shall see later on how the disease spreads, either maybe their clothes or they have stayed in the same household. For example, there is a school recently where a child tested positive. So all the school children who study with him, with that baby, will all be contacts, but they are classified depending on how close you are, either as primary contacts, secondary contacts, or even tertiary contacts. Let's go now into the virology of the disease. And this is where I want all of us to pay attention, and if you have questions, because at the end of the day, as young people, whichever decision we shall make after here will depend on our understanding of the virology of the disease. So this disease can actually cause serious illness, and it's often fatal. Without treatment, the mortality rate is really high, and we can get lessons from West Africa, where Ebola badly hit the place. Although there were very high recoveries as well, but the case fatality rate was also equally high. But the chances of survival are usually good, especially when a patient presents in the early stages. I'm going to talk about later, at a later point, the different stages of the clinical symptoms. So if you come in the early stages, and this is where the youth are on the call, the young people who are on the call, this is going to be one of our areas of interest. How can we report cases early enough? If it is your father, if it is your mother, if it's yourself, please do not wait to deteriorate. And Ebola belongs to a broader group of diseases called viral hemorrhagic fevers, VHF. Viral hemorrhagic because it's caused by a virus, Ebola virus. Then the bit of hemorrhagic because in some cases it will present with bleeding, but not all Ebola patients actually bleed. Many people think not until you start bleeding will you actually have Ebola. No, we are going to see the signs and symptoms, but bleeding comes in actually at a later stage. On the next slide, it just shows the etiology. You may not need to know the deeper science of the virus, but just for you to know that we have more than 6 species, about 6 species of this virus, but the current one which is hitting Uganda is called the Sudan Ebola virus. The 2 strains which usually hit us are the Sudan and the Zaire Ebola virus. The good news is that the Zaire Ebola virus has a vaccine, but the bad news is the one that we're currently facing, which is the Sudan, has no vaccine. And unfortunately, the one of Zaire, the vaccine of Zaire, cannot actually work on the strain from Sudan. And on the next slide, I will just more hint a little bit on the Sudan strain. I already said that the first outbreak happened on the 20th of September, and this is the 5th of its kind, the 5th outbreak for the Sudan variant. There is no approved vaccine, no approved treatment. We actually treat symptomatically, more or less really like what we saw in COVID-19. The patient comes with headache, you manage the headache. If they are dehydrated, you give them fluids. And most of the data in the subsequent slides are based on the experiences we got from the Zaire species. We hope they can be applicable. So on the next slide, we talk about what are the natural reservoirs for this virus? And it is important for you to know because moving forward, your 2-year-old young brother will ask you, but where did this Ebola come from? You know, at least for COVID, we have a linkage, we know from the seawater in China somewhere, subsequently into the human population. So the natural reservoir means the organism that can hold this virus for a long time without actually shedding it, without expressing it to other organisms. So it keeps it, and it has been shown that the fruit bats, I don't know how they call them in your local languages in Uganda, but these are wild bats. They're not the normal bats we see in our homes, or these are wild bats which stay in forests. And it was first identified in 1976 in the Congo, in the Zaire River, that's DRC, and subsequently that's why it was called the Zaire variant. So these fruit bats, go on the next slide, please. When they are infected with this virus, if you see this transmission, it's important for you can take a screenshot of this for purposes of further reading. The virus is first maintained within the fruit bat population. So these are fruit bats, they are in the sky. So how do they end up into human beings? So there are 2 ways. Either the infected bats spreading the virus to humans. I think you can see, I don't have a cursor here, but you can see the dotted arrow pointing towards the gentleman. But our interaction with fruit bats is really minimal. That's why we can't consider that as a primary route of initial transmission. Most of the transmission from the fruit bat, there is that thicker arrow that goes down to the primates. Now, most of the primates which are of interest here are gorillas, kangaroos, and monkeys. So the infected fruit bat will transmit the virus through its fluid, either through urine or feces, into the primates. Now, the human person will interact with these primates, and this is usually what brings the outbreak. Either, most of these primates are in really wild areas. Please back on the transmission chain. So the gentleman whom you're seeing is going to interact with the primate. Either will eat the monkey, or will go to hunt the kangaroo, or will go to, interact with these primates. And in the long run, he will be infected by handling them, or even handling items which have been contaminated. And now the biggest paradox, which all of us as young people, we need to, garner our energies to, is the human-to-human transmission, because it's the hardest to control, it's the most dangerous, and human-to-human transmission, like I'm going to say on the subsequent slides, is mainly through body touch, either through fluids or through body clothing or even instruments. So the next slide emphasizes the point of where is the Ebola virus found in an infected person. Everyone, please master this slide. Someone's body fluids are very dangerous. Someone who has been infected with the Ebola virus, saliva, sweat, blood, vomitus, diarrhea, that's the fecal or stool matter, urine, sperms, and talking about sperms, just to emphasize that kissing is also a very common way of spreading this virus, and young people are usually very sexually active, so we need to emphasize the point that actually Ebola in quotes is a sexually transmitted disease, because you can actually get it through a semen, through sperms. Then pregnant mothers can also infect their babies through amniotic fluid and breast milk, breastfeeding. That's why we don't want any breastfeeding mother who tests positive to continue breastfeeding. I hope we've mastered this slide, because this is a masterpiece slide. On the subsequent slide, we also emphasize the importance of spread. I already talked about fluids, but also alongside the fluids, someone can get Ebola through direct contact. For example, broken mucous membranes. Okay, I know I may be speaking a lot of science, but basic really would be you can get this Ebola through directly getting in contact with someone. Mucous membranes are the ones which line the inner linings of most of our organs, let's say in the GI, but let's not go that side. Then contact with objects, for example, needles, sharp instruments, and important to note here on objects are the clothing. Please, the slide is not close up. Conrad, you try again to do slide show in case you can. People need to read the words. But if it fails, we shall have to proceed. In case you're in touch with someone who has tested positive, or a dead body of someone who whose sample tested came out positive, please do not get in touch with their clothing, with their beddings, even the utensils they have been using, because all those can be infected, and this virus can spend about 3 to 5 days, depending on the circumstances, because depending on the conditions, on a surface, and also depending on the surface. For example, that's why we're going to encourage you to, routinely do hand washing, especially those who are like in the high risk areas. If you know that you're staying in Chegera, congratulations, you've succeeded. Those who are staying in the epicenters, if there are any health worker students on call, you will need to routinely wash your hands, disinfect door handles, elevator switches, because those areas can actually harbor the virus. Next slide, please. And now this slide is really self-explanatory. Ebola does not spread through air, through insect bites, and through water. Although there is a small recent study that is showing that through respiratory droplets, someone can actually get infected. If I have Ebola and I cough, my sputum can actually, or my air droplets can actually contain viral particles within them, although it's not yet conclusive. That's why we shall encourage all of us, please, if you know that you're going out, wear your face mask. And Ebola, COVID already taught us how to wear a face mask, how often to dispose them off. I will not emphasize that. It does not spread by mosquitoes. Please do not say I was bitten by a mosquito and now I have Ebola. No, that's not true. And I emphasize mosquitoes because in the presentation, many people are going to come with malaria-like symptoms, and Uganda being an epicenter. Let's go on the next slide, please. Rather an endemic area of malaria, we need to emphasize that. So what are the clinical manifestations? So those are on the call. I don't know how many, I'm unable to know how many people on the call, but I assume maybe 20 or I don't know, 30.
As we talk, there are 34.
How many?
34.
34. If the 34 of us here forget everything, just remember this. Because if you're to really respond in your community, in your family, you must know how this virus is going to manifest. How is it going to show? How will I know that my dad or my mom or my girlfriend or my wife, for those who are married, is actually having this virus? So the next slide, please. If you can, please take a screenshot of this picture, because the screenshot of this picture will summarize for you the I can call it the flow of the infection in a person when they get exposed. So I'll begin from the site of infection. So infection occurs after you've gotten exposed either to a sick person or to a patient who has died of Ebola. So you see that gentleman who is standing just next to an infected patient. That could be Ignatius. Sorry about that. Am I still audible? Because I'm using 2 devices. So after getting exposed, it takes about 2 to 21 days, what you call the incubation period. Incubation period is the time when you actually have the virus within you, but you're not showing symptoms. And the good news is that when you don't have symptoms, you actually cannot transmit the disease. You're not contagious. You're not infectious. But we can't say 100% you're not infectious, because, diseases don't read textbooks. This is from research and from prior outbreaks that usually 2 to 21 days, someone is not having symptoms. But 2 to 21 days is a very big range. So you may start getting your symptoms on day 3, for example. Another one, because of his strong immunity, may fight off the virus, fight it off up to, let's say, day 20. And then after day 20, the body gives way and the symptoms set in. So it varies from person to person. That's why the range is a bit bigger. So after that incubation period, I think you can see on the arrow down, from exposure to the virus up to day 0. Day 0, we count day 0 on the onset of symptoms. The moment someone starts getting fever, headache, joint pain, muscle pain, sore throat, those are initial and non-specific symptoms. We say the person has become symptomatic. And the moment you're symptomatic, you are contagious. You can actually shed or spread this virus wherever you touch, wherever you meet. The good news is that at the start, these symptoms are in what you call the dry phase. Dry phase means that, yes, you are contagious, but you're not like really, really badly contagious. And my call to all of us is, the moment you see someone with any of these symptoms in your community, plus they have a history of travel, let's say they have traveled from one of these 5 districts I already talked about, or there is a history of contact with a confirmed or a suspected case, then please call for help. I'll tell you the alert line towards the end. Call for help. And that's one of the ways young people, you're always very active on social media and you're always following things. Don't wait. Call for help, because if this person in the dry phase crosses over to the wet phase, it's usually very hard for them to come back. Clinical recovery is poor when you're already in the wet phase, but when you identify these symptoms early, you can actually be managed, and recovery, you've already seen recovery is being reported. So wet phase, which other symptoms are they going to come with? Diarrhea, nausea and vomiting, bleeding in some cases. That's about 50% of the population, they will bleed. That's bleeding from the mouth. Those are the gums. Vomiting blood, passing bloody stool, if I get exposed today, if I'm in town in Kampala and I am in touch with someone who has Ebola, it may take me up to 2 weeks for me to become very infectious, but don't wait for that point. And let me conclude this slide with this last point. The amount of Ebola virus is highest at the time of death. Dead bodies are very infectious. Please do not try and teach the people in the community, do not try to do your own burials. Call for help. There are dignified burial teams under the case management team that are responsible for burying these bodies. Otherwise, you're going to all get very infected and it will be very hard to manage. How do you know that someone has Ebola? We've already talked about the signs and symptoms, but those signs and symptoms are not enough. If someone has a history of travel or contact, like, because Ebola has come at a time when we also still have other diseases. We have COVID, we have malaria, we have all these other diseases which can present with similar symptoms. But if someone has unexplained bleeding, like just all of a sudden you meet someone in the corridor, if you're still at campus and you meet someone that's in the university, in the campus premises, and is all of a sudden bleeding with no explained cause, please just call for help. So these people should always be isolated. It's a serious disease and it puts very many people at risk. I can tell you from experience currently what we are facing in Kampala. It's not easy. Someone borders a judge, that's a border, goes to visit their friends, or they go to a clinic. When they reach in the clinic, they start vomiting blood. Now the clinic refers to a bigger hospital. They reach in the bigger hospital, they are isolated. When they pick their blood sample, it turns out positive. Now we have to start contacting, what you call contact listing, right from the person, the border person. We don't know whether he stopped somewhere, maybe on a shop to buy something. We don't know the people whom he has been staying with in the house. If, for example, he went in a club the night before or a football match, it's very hard to manage if all of us don't act. So people who are in contact with other people should be avoided. If you meet someone and you suspect, you have to isolate them. A large number, I'm going to read it for you at the end, and immediately you call for help. On the subsequent slide, we talk about contact tracing, but this is not really more for your consumption. It's more on the health workers side. You see the gentleman in the middle, the lady in the middle who is in red, where the cursor is. If that is your index patient, the first patient who gets Ebola, let's say in your community, he's going to be in touch with so many people, and each of those so many people will be in touch with so many other people. So unless each of us take the precautions as community people and win the trust of the system, the healthcare system, we are not going to manage this outbreak. But I know we are going to with our help. We are almost coming to the end. Next slide, please. So traditional funeral practices, please avoid. Unprotected healthcare workers. I am seeing medical students on call. Please do not be healers. We recently attended the 20th Matthew Rukia Memorial Lecture. Those who are not in Uganda, Dr. Matthew Rukia is one of the people whom we always appreciate his heroic activities over 20 years ago. He was, we went to attend to Ebola patients, and it was a time when no one wanted to touch them. But unfortunately, as he was attending to them as a caring health worker, he also got infected and died in the line of duty. So we want health workers to also protect themselves, try as much as possible. Then on the next slide, now we come to, okay, this is really the basic thing I've been talking about. Not touch contact, do not touch people who have been, like if the ministry comes to pick someone from your community, do not enter that house. Don't eat with them, don't just avoid contact with them. On the next slide, although this is more for the health workers really, report any possible case. I've already talked about the symptoms, and I wanted to read for us the toll-free number. Everyone, please get a pen and a paper. If you've not been following, at least you start following from now, from here. Ebola toll-free. So it is 0800. Can someone confirm to me that you are following, because I may be reading to myself?
Yeah, yes, doctor. Yeah, we are following and hearing you clearly.
Yes, it's 0800 1000066. And I repeat, 0800 1000066. 888-888-6666. Please call that toll-free hotline, and it will guide you to ask whether you want to speak in English, in Uganda. Report that suspected case, because it's better you report and we find when they're Ebola free than not reporting, and days down the road they actually get symptoms. You've already seen that when you progress into that wait phase, it's very hard for you to get better than if you had presented in the early phases. I think we're almost coming to an end. Maybe like 2-3 more slides. Next slide, please. Okay, so what do we need to do as young people? Next slide. Young people, we are very energetic and very active on social media, on WhatsApp, on LinkedIn, on Twitter, on Facebook. We need to get lessons from COVID-19. If you remember, during COVID-19 pandemic, there was a lot of information on social media. My God, everyone became a doctor. Like everyone was preaching their own. Today, someone would come and say, "You people, I have gotten a herb that reduces the symptoms." And people started using every type of herb that has ever existed in their neighborhood. People steamed with every type of grass. We need to fight. I call it an infodemic. Leave alone the pandemic. People were being misled with information, wrong information. We need to really learn lessons from that infodemic, and let's get the information from trusted sources. We have experts in the fields. People are going to be coming on TV, and people who are experts in the field of epidemiology. Please use that information. And social media is a very big tool. So what take home am I giving the young people, fellow young people on the call? Can we have social media champion campaigns? I remember during COVID, I was one of the one-on-one Africa COVID champions. And what we are doing basically is to, we just said to ourselves, we are going to be posting every evening at 6 p.m. different lessons or different things about COVID-19. That was during the COVID pandemic. Let's say today we're going to talk about signs and symptoms. Tomorrow we shall talk about the role of, let's say, isolation. Like we kept on looking for different topics in regards, and we had right sources, because we had to call the ministry and make sure that we are getting the correct sources, not just going on social media and you pick what someone has posted and everyone is excited about it, and you find you're retweeting or you're putting on your WhatsApp status. No. So the people on the call, we can all participate in spreading this information. I'm going to share these slides. Please share how the symptoms present. Let people get to know how they can know that they are sick, and it is okay to be sick. It is okay, because none of us invite Ebola. The most important thing is, when you're sick, how responsible are you to ask for help? Because if you don't, we are not going to manage this outbreak. Then very important, community mobilization and sensitization. I assume by the time we are using Zoom and we are using our devices, we are all elites, and we can really do some form of community support. If you're a medical student, if you're a campus student, in your community, on your class, can you be the one who will preach the message of people, please trust in the existing systems? Go and report yourselves in case you feel like you have a problem. Or you are the one who is going to come and say, no, face masks should not be put off. You're going to be the various one, refusing the different platforms which organizations have put for us to manage this pandemic, this epidemic. So please, let's do the community mobilization and sensitize them. We are the people who have been graced with the knowledge. Let's use it to inform people around us. And what lessons do we learn from West Africa? I already said, and also in the fourth Ebola outbreak which we had, we need to learn how to win the public trust. When I talk about public trust, I'm actually talking about us, the 34 people on this call. After here, if each of us went and equipped ourselves with a knowledge or with this virus, and spread that information far and wide, it would help in curtailing its progress. The lesson we learned from West Africa is, in West Africa, people refused. At the start, people said, no, you guys are jokers. You want to, maybe eat money, or, Uganda, Africa has so many different theories, and I don't know which one I can use. The earlier we respond to this, the better. Please, let's not wait. We saw what happened in West Africa. There are so many dead bodies. But the good thing is when they woke up to respond, there are also very many recoveries. I think that was my last slide, unless, is there anything else? Good. I prepared these slides when I was in the field. I'm sorry in case they weren't satisfactory, but really if you can forget everything else, but my take home are three things. One, as young people, let's take the initiative to equip ourselves with the knowledge. Let's not just go on Twitter and on WhatsApp, and we allow people to deceive us. Yet we have credible sources of information. I'm seeing the president of the Federation of Uganda Medical Students on board. Thank you very much. I know we are coming up with an idea of how medical students in the country can, be more resourceful during this period. Second thing, let's use our social media very well. Alongside other things we are posting, let's also post these what's going to break the stereotypes. And very important, let's also psychologically support the people who have been infected in our communities. Thank you very much for listening. I took more time than I anticipated because I had to explain a few concepts. Thank you very much, the organizers. I beg to submit. Thank you very much.
Thank you.
You've done a great job, and you're more than welcome to take additional time if you need to. Yes, go ahead, Conrad.
Yeah, from Stanley, I'm sure he's traveling. He has classes this evening, and I want to thank you so very much, Dr. Asasra, for all your time and for creating time to prepare this slide for us. It has been of great help. Personally, I think I've learned a lot from it. I had not taken time to understand how COVID is really Ebola is affecting people. I'm still in the other COVID era, but I thought it is still small down there. I really didn't consider it to be something big. But from all you're talking, I think there is much tension, and really we don't need to be at hype to say, this is going to kill me, this is going to kill the other person. The good thing that you said and I wrote down was, when you are sick, how responsible are you? So if someone gets sick, how do you really respond to this? How do you make sure you're not on panic, you're not going to spread this to everyone, but then you take time, maybe it could even be isolation. You can isolate yourself and be somewhere in a room, take good care of yourself, and then take medication. But what I really need to know is there anything like medication that is on market? Let's say I feel I have this and I have maybe fever. It could not be Ebola, but it could be fever. I have the signs. It could not be all the signs, but I have some signs and symptoms. And then maybe I don't have money to urgently go for the test, but then I feel I'm not feeling well. Is there any medicine I can buy at that specific time, maybe to prevent me from too much fever, or maybe hypering the infection, the virus itself? Is there any way of preventing it so far, so that maybe when you get to the hospital, or maybe by the time you have called this number and they're coming to pick you up, there is something you have already put in yourself, or it is not advisable? Because at some point when you're going for tests for malaria, someone asks you if you have already taken some medicine. And then if you have taken some medicine, at some point, this also prevents someone from getting the virus from you. So the medicine that you have taken prevents the doctor from getting the virus. So do we advise someone to take the medicine? Is there a medicine? Or when something like that happens, you have the signs and symptoms, just call a phone number and then stay home. Maybe they can come to rescue. Maybe if you can reply to that, and then after that, we can have questions from different people. Thank you.
Conrad, as the questions are coming, another important concept I really wanted to emphasize is the fact that Ebola is currently with us. Please don't think it's still in Mubende and Kasanda and in Kampala we have, we are safe. And I don't want to scare you that we are doing very badly off. We are actually trying to contain it. We are doing well. But what I want people to take is the corporate social responsibility of knowing that it is already here with us and we need to act fast. Thank you very much. But let me respond to your question. Are there any particular meds someone can take when they feel bad? The best answer I will give you, please don't take any medicine. Just go and seek for medical help, because I will tell you that from what you've seen in the cases so far we have in Kampala, most of those who tried to do self-medication initially thought maybe it's malaria, the anti-malarials were not responding. And I don't want to say there is medicine for first aid, because first aid, ideally, you're saying you want to resuscitate there and then before you can refer to the hospital, unless someone is having like maybe really skyrocketing fevers, and you can give an antipyretic, let's say paracetamol, as you call for help. But what I'm trying to avoid is now you're having fevers, you're already symptomatic, you're already, you remember your contact, and now you're going to a drug shop, you're going out also spread to the drug shop or keeper, the lady there, and then you come back and then you're touching here, you're touching. That's why it's better. Just call the number, ambulance comes, picks you up, takes you to isolation. And in isolation, I can assure you the Mulago isolation, Entebbe isolation, Chirudu, there are doctors who have been trained to manage these symptoms. Please don't try self-medication unless otherwise. Any other question?
Hi, Ignatius, thank you for a very powerful submission there. Now I have a quick one. In most of the signs you said are, on the other hand, the signs you often get under normal circumstances. You have a common cold, fever, and headache. Is there a way you can make a difference when you feel you have some flu or a headache? Is there a way the Ebola flu or the Ebola headache is a bit different from the normal cold and headaches? Thank you.
Unfortunately, there is no difference, because the fever is all having that body temperature above the normal ranges, where we're going to say above 37.5 or sometimes up to 38. And it's really almost the same fever as the one in malaria, the one in these other infectious diseases. So I remember there is a patient I saw who was a TB. It was an alert from the community, and he was vomiting blood, and everyone was scared, everyone was running away. And by the time we came and picked his sample, it turned out negative, but this was a non-TB patient who had defaulted medicine. He had refused to take medicine for some time. So his vomiting blood, this is good that the community responded there and then, but not everyone who vomits blood is actually having Ebola, and not everyone who has Ebola is going to vomit blood. So there are other symptoms that are, and like you've seen the wide range of common cold, headache, fever, body pain. Most infectious diseases will actually present with similar symptoms. So it's, and the unfortunate story is that symptoms are similar. Unlike maybe the COVID cough used to be dry, but even here the cough is really, it's a paradox. Some people are having productive cough, others having dry cough. So you can't cast it in stone. And even from previous epidemics, or rather outbreaks, it's still a mixture of symptoms. So you can't say cast in stone the Ebola fever or the Ebola headache is in a particular level of description. It's really almost similar to headache like others. That's why we all need to have what you call a high index of suspicion. Someone comes with those symptoms, and you know that in his family, maybe they had a patient who traveled from any of these epicenters, or in his school, or in where he stays, there was a suspected case of Ebola, or that is, don't even think about it, just know that's a suspect. Call for help. Yes. Unless there are other particular questions, Conrad, I think we should be coming to the end of the presentation.
Yeah, sure. We have another hand from Mr. Isaiah Gabriano, and then after him, I have the last question. and then we can hear from other members. If there is anything, we go. Yes, Mr. Isaac.
Thank you, Conrad. And thank you, Ignatius, for the very powerful presentation. My question or my worry is with this Ebola virus. I mean, the symptoms are quite similar to these other diseases like malaria, you know. So in case a friend or in case a family member comes to you, they're having fever, they're having headache, and maybe you're aware that maybe they traveled from a certain district XYZ in the recent past. What are we supposed to do? Do we just call the Ebola helpline? It's a tricky situation because you don't want to act like you're not staying away from your loved ones. So it's how do we handle such a situation? Thank you.
Yes. I get you. I see someone in the chat saying, Malif, please don't run. Please don't run away from your loved ones. We still need you to be with them. And I want to emphasize the point of psychosocial support. If it were you or me and people are saying that you have Ebola and everyone is just running away from you, it's like you're a bad omen. Even psychologically, there is a way how you get traumatized. That's why if you have a relative who is a suspect, please don't run away like emotionally. You can run away physically because we don't want you to get in contact, but stay with the person, and the precise answer to your question, especially at the peak of an epidemic like now, the precise answer to that relative of yours, just call the helpline. Call a helpline and explain to them. But of course, you're not going to start massaging them and give them hugs and say, no, everything is going to be okay. You let them be in their isolation room as you talk to them, keep them engaged. The reason why I say call the helpline is we saw the first case we had in Chirudu after they had buried the gentleman who passed on. The wife actually ran away. She put off her phones. It was very hard to track her down until we used CI phone tracking systems. This was a pregnant mother, and for the medics in the house, you need to know that one of the side effects of this virus is that it will cause preterm labor. Like mother goes into labor before the actual term delivery. So at 28 weeks of gestation, she now gets into labor pains. She has to come to another smaller health center 3. Initially, they were in a national referral, but now they go to a health center 3. For normal delivery, the nurses there didn't know that this is an Ebola contact runaway case. They attend to her, deliver the baby. Baby, fortunately, is alive. Disperse of the placenta. But fast forward, you realize that if the people at the woman's home, because where she was staying at that time, they actually knew about the husband who had passed on. But these people were keeping the wife and saying, no, everything is going to be okay. We don't want now, if you come, you're going to be isolated and you'll be taken in a prison in courts and you'll be mismanaged and, but you know what happened fast forward? The lady tests positive. All the people in the family she was with, her contacts. And I'm telling you, it's just terrible. All the deaths we've had in Kampala, even in Kasanda, in Cherera, in Mubende, we are seeing many of them. One of the biggest challenges we are facing are relatives who don't want to report under the cover of this is my dad, this is my uncle. I want them to keep calm, everything is going to be fine. No, Ebola will clear us if we don't respond. Nothing is going to be fine unless we act. It's better you act. After 21 days, your person will be released from, not released, okay, discharged, let me use that word, discharged from the isolation unit, and life goes on back to normal. Then you keeping them for another 10 days, and you lose the patient, and subsequently also test positive. So the precise answer is call for help.
The other question that is coming in from here, are there local centers or hospitals that are testing Ebola, or one must go through the helpline? And then my last question was, are viruses treatable? Does one treat the virus?
Are there local centers, hospitals that are testing? No, we are currently not testing for Ebola. We are only doing screening. We only test symptomatic cases. What do I mean? The test of Ebola is actually pretty expensive, because unlike COVID, where you knew that you would, pick a swab and there are different testing units. At the moment, we have only one lab that is doing all this in the country, and that's Uganda Virus Research Institute. And that test is pretty expensive. So unless you have symptoms and you're really a high risk or maybe a secondary contact, they are not going to pick your sample to test. The best thing is to monitor the symptoms. So there are no local centers or hospitals where you're going to say, you wake up tomorrow and say, I feel like a fever, let me go and do a test. Unless you are really, you've passed through the helpline, you're not going to work in a hospital, and there are no rapid diagnostic kits, for example, at the moment, which have been rapid diagnostic kits mean, like these malaria kits where you just go in a pharmacy, they give you a malaria kit, go bleed yourself, and you say, I'm now malaria negative. Or HIV kits, actually, HIV also has similar kits. And the last question was, remind me again.
I was saying, are viruses treatable?
Yes, viruses are treatable. And I can tell you there are some which have actually even been eliminated. You've heard about smallpox. It's now there are some countries which completely eliminated smallpox. Unlike many other viruses, these which cause viral hemorrhagic fevers do not have particular treatment. There's no tablet that you're going to swallow and say, now I'm free from. There's no tablet you're going to swallow and you say that I'm free from Ebola. That's why we treat symptoms. So yes, they are treatable, but we don't have like a particular cure. Let me use that word, a particular cure for them. Thank you very much for hosting me, and I hope you've learned something. Have a blessed evening.
We surely did.
Yes,
We had the last person, but I think because of time, we'll just have to let you go. But all the other members, I'm sure we have medical personnel here who would really wish to reply to certain questions that may come in, because I can see we have a hand from Dennis Tumuramie and Ali Twino. The first hand was from Ali Twino. I think it will just be an open question. And before our guest speaker leaves, I want to thank you, Doctor, for creating time, and once again for allowing our invitation. I'm sure it has been of great help. Personally, I've learned, and I'm sure even people out there have really learned. And thank you, the audience, for being so good, because we didn't have these people of unmuting and muting your mics on and off. I really thank you for that. And we are still here. We can still learn from one another. If we have any personnel right here, or maybe if you just send in your questions, I'm sure I can send these questions to Doctor, and then later we can get answers. You can just contact me. I'll send you my email and my phone number. And then I will also need to contact him later to get these answers. You can also have the answers on our website later on, or on our social media accounts. But of course, it has to be from verified people, not just from, I have heard of this, I've heard of the other, and then it affects all of us. But let's have a question from, or maybe a suggestion from Ali, and then Dennis. Thank you.
Okay, thank you so much. My name is Dennis, and fourth year medical student from King's University. Thank you so much, Educational Missions and Dr. Ignatius, for the wonderful presentation that has come in the right time, and I hope it has fallen on the fertile soils. Mine is not a question, but I would like to know more. You said that you have the hard copies of the books. Are those books for free? Yeah, just need to know if whether for free, and at what time can we one may be able to come and pick a copy. Thank you so much.
Thank you so very much, Mr. Dennis. And I'll tell you that all these books are for free. When you just come to Tintadle, you'll be able to get a copy for yourself. We are not selling these books. They are free copies.
Thank you so much,
yeah.
Mr. Conrad. Sorry, I have a network interview. They have been trying to call me, so I'm using my phone to connect, but I hope I can be heard now. Do you hear me, Conrad?
Yes, yes.
All right. Thank you so much. I just want to first appreciate my comrade, my colleague, Dr. Ignatius, and also thank you, Educational Mission, for organizing this. I'm really very privileged to be part of this, and I'm the elect FOMSA president, so I'm really very happy to be here, and I've been informed that these talks are usually there every Tuesday, so every time I have some time, I will be passing by to listen and learn a thing or two. So on addition to what Dr. Ignatius had exhaustively discussed, I just want to emphasize my point here that the main thing with Ebola here really is we need to do a lot of community sensitization. And especially as the youth, we need to make sure that we sensitize our communities. Otherwise, if we don't do that, we may end up getting, the whole country may get up getting infected. Because as you've just heard from this noble discussion, unlike COVID, Ebola really is a bit preventable. The key thing is about contact. If you avoid the contact, then it is easier. You realize you can actually be in the same room with someone with Ebola and you don't get infected, unlike COVID, where you cannot be in the same room with that person. So the main issue here is we need to really emphasize to our communities that Ebola is really preventable, and we really need to emphasize on this of transmission and what have you, so that of Ebola, because if our people knew, then we wouldn't be having cases of people running away from getting medical help, And then the other issue about the stigma, actually, this is why whenever the ministry now is emphasizing when they are integrating, there is integration of the people back to the communities, because when someone is isolated, the community still thinks that this person can still transmit the disease, yet it is not the case. However, the government is trying to sensitize the communities about this and to avoid stigmatizing the people that are out of isolation. I'm very sure if we do this, we sensitize our communities, because you realize now there are talks of locking down Kampala. So if we work together, I'm very sure we shall overcome this, and it is high time as the youth, the medics, and the people that have got this knowledge, we need to disseminate it to the people down there so that they can support the government in trying to avoid this pandemic. Thank you so much. That was my submission.
Thank you very much, Mr. Twino, and for also making it to the meeting. Yeah, our meetings are always on Tuesday. We invite all of you to come again. We have a hand from Mulungi Jonathan. Please go on and tell us what you have for us.
Okay, thank you so much, Dr. Jonathan Mulungi. I'm currently in Kisoro. Thank you so much, Dr. Ignatius, for what you've shared. I think the information you've shared, I think, is really worthwhile. You made this Ebola thing look like something that the information you shared someone can be able to understand it better in an easier way. And I think at the end of it all, we can actually work together. We can actually bring this to a standstill. And again, as what Professor Maso said, engaging in the community members, making people know that actually we have the power to own this and actually work together to achieve a common goal and the common purpose is something that is actually desirable. So I think this is really, really good and well thought of. Thank you so much. Ignatius, back to you.
Thank you for appreciating. It is always very good for someone to say something, and then when you benefit from it, you say thank you. So we want to thank all the members that really created time to make it here. And then allow me to take you within 5 minutes to just take you through our website where you can get most of the books that we're talking about. And of course, you can also get to know about the website I was talking about. So this is our website, educationalmissions.org. You'll just get to the website, and from the look of the website, I'm sure you will love the website. You will like the website. We have a video here. It is talking about the logic die as well. It is talking about side 1 up to side 3, but we have other several videos on YouTube. From this same, you can still go to our YouTube channel. So you have everything presented to you. And then from there, if you come to resources, under our resources, we have the Think to Prosper free ebook. So when you click on this button, trust me, you'll be taken to a PDF. You can download the PDF version. That is the soft copy of the book. And then you will have all these pages to read. It's not a very big book to read. You can even take your about 2-3 hours and then finish the book. So when you have time, just get that book. And then the other book is The Richest Man in Babylon. It is just right here. We have the book. This happens to be a very big book that is competing worldwide, and this is the second edition. So it is a very nice book. We have QR codes. If you have a QR code reader in your phone, you can scan for the QR codes in that book and then watch videos talking about the same. It is like someone is just reading for you what is in the book, or someone is explaining for you what is in the book. And then from there, if you don't want to use the QR codes, when you go to the morehelp.us, you'll just have a look at these QR codes. I think there's very many. You just need to go through all of them. But when you get the book, trust me, the links are just outlined there. It says morehelp.us, then it says /C1. That is one video, then C2, C3. When you download the book, trust me, you'll see these videos. I didn't want to take us there. Then the other thing that we have here is our free educational library. And our free educational library has several things that we can go through, because we are all focused on trying to help people learn and get something on table, because our main goal is to make sure that at least someone can earn a living from whatever we are trying to teach. So if you come to our free educational library, we have several videos. Before we go to the videos, we have Khan Academy. I have used Khan Academy before for my programming courses. Angela has used Khan Academy free before, and Khan Academy is just a free online school. You just go to the school, apply for a course, and do the course for free. The bad thing with it is you won't get a certificate, but it is just learning. You just go and do your personal learning from there. You're a teacher, you want to do research, you want to set exams, just go to it. You'll get what to set, you'll get what to teach. You're a student, you want to get something, you want to learn from it, just go to it. Maybe to just show you what Khan Academy looks like. This is their page, and this is where I do my course from. You can see where you can see ticks. Those are some of the courses that I've done. But when you're a new student, when you go to that site, you just need to log in. Please don't provide any coin, because there is always a pop-in that comes saying that you need to give a donation, something like that. But we are always giving in a donation. When you click on this, Education Missions itself is always giving in a donation every month to Khan Academy to make sure we are able to access this for free. And that we have done, and we are still doing. So if you have time, just look at this. Go to Khan Academy, apply for a course, do a course. It can help you maybe somewhere in future, it could just be for you, just for your learning. It is like a hands-on learning. Then from there, when we scroll down, we also have other classes. These are for maybe kindergarten. This is Excel in mathematics and science. I've always used this for some kindergarten students. So this is good for kindergarten. This is a logic diet we were talking about. This is how you can make your personal logic diet. I also made mine for myself. You can do one just to help you in the learning process. And then we also have fundamentals of graphics. Some of us are doing graphics. I'm a graphics designer. So I've always done several courses from here. Sometimes you're there, you want to do something and you don't know how to do that thing specifically. You just run to YouTube and you're like, so how to do this? But we have several videos specifically for graphics. These are 25 videos. When you just click on them, you watch the videos. Then we have a beginning for web design. This is also for web designers. I'm a website designer, so I also always go to these videos to just learn from them. Then to scroll down, we also have these. These are just some things that you can just do for yourself. They are just creative ideas. You have paper, you have maybe bottles, you have several things, covers, and you want to design something from them. It is just something, you just need to be creative and then you innovate something. So these are some of the things that you can look through. You may not specifically do something like this, but you can do a different thing and then you start selling it off. So when you start selling it, then you have money, or you don't want to buy it and you want to have it in your room. I've seen several people have bottles, maybe wine bottles, and then they have some flower growing in that. But if you're to buy that flower, trust me, it's going to cost you a lot of money. So what you can do, just create your own. Just have a bottle, put in water, and have a flower grow in that. So that is something you can do. And several other things. This is free web and graphics design, beginner for coding, HTML, and the other creative ideas, learning item. This is from Amazon. Then we have journalism courses, free digital, like we have several things. So if you just spare time, go to our website, have a look and a feel of this. We have several emails there. We have phone numbers. You just contact us and we'll be able to help you. So in case you have some time, please go to that website and then let us know how we can be of help. And then if you want to really get back to us, the same phone numbers and the same emails can bring you back to us. And the other thing is, if you can create time and go to YouTube, to our social media accounts, and then you just subscribe. This same video that has been presented today, or the live video that has been on today, is going to be edited, and then we are going to have it on our YouTube channel. So when it's up and you have subscribed to our YouTube channel, trust me, you're going to have a look at the video. We expect comments, and we expect you to also appreciate our doctor for creating time to make sure this is live. Allow me to say once again, thank you all the members that made it for today's meeting. For the last time, send in my phone number, and then if you have time, please send me a message or call me. We can still talk. Or if you want to be our guest speaker, you have something to share with us. We are really so happy to have you as our guest speaker. Or you have something to share just to the community. You never know. There is a lot of people coming in different days. Today we have you, tomorrow we have several other people coming in, and then maybe you can talk about yourself and people get to know you. So it is also a way of marketing yourself. I'm sure now for all these other 30 something people now know Dr. Ignatius, and when we share his contact, I'm going to share his contact in the WhatsApp group. When we share his contact, I'm sure he can be a personal doctor or a family doctor to one of us. So at least you have a doctor you know in your family. Or maybe for your research, we had several medical students right here, and they can always contact him for certain information. So it is something good that you can really get, and that is what we call social capital. So for social capital, when you join that, you have a contact, you have someone to contact when you have a research. So I'll just need to end the meeting here if we don't have any other submissions from people, but I'll still say thank you, and we invite you to join our meeting Again, on Tuesday, we'll have another guest speaker. You will see this on our social media. I'm sure by Friday, the guest speaker flyer should be up. So that is all from me. I'll need to say good night to all of you and bye-bye.